All right, it's finally come that the Republicans are acknowledging, or at least admitting, that, yeah, we're going to have to make some cuts to Medicaid. Now, they're going to try to spin that a million different ways, and we're going to talk about some of those ways. So, here is one way that they plan on doing it. Republicans consider unraveling a key part of Obamacare in Trump's agenda bill. Let's read. Top Republicans are considering rolling back a major piece of the Affordable Care Act and their massive bill for President Donald Trump's agenda, exploring savings by slashing how much money the federal government spends to cover the 2010s law expansion of Medicaid, which that expansion granted Medicaid access to dozens of millions of people. So a very good thing. Rep. Brett Guthrie, Republican from Kentucky, surprise, surprise, the chair of the House Energy and Commerce Committee, made the case for it Monday as Congress returned from a 2-week recess, saying Medicaid spending is growing at an unsustainable rate. Medicaid spending is growing at an unsustainable rate. But we're not even, military spending isn't growing at a unsustainable rate. Defense spending in general, whether it be, directly to the military or border security, mass deportations, ICE, DHS, whatever. That's not unsustainable. In fact, like we can raise their budgets by hundreds of billions, but Medicaid spending is unsustainable. Got it. Okay. We have an expansion population that gets 90% federal money, and you have traditional Medicaid so a disabled child in Kentucky gets 72 cents when they go to the doctor, and we know that's just unsustainable, Guthrie said. We want to fix that so everybody gets coverage, so I think it's going to be a really responsible response. What do you mean? Okay, so you want to cut Medicaid, and so you want to cut this expansion, and in turn that's going to cover more people? Like, I'm failing to understand the logic here. This is the Republicans' logic for everything. It's like, oh, no. Even though we just cut that agency and, fired half their staff and cut their budget by millions or billions, it's still going to function the same. You won't notice anything different. It's like, okay, sure. In fact, it'll work better. It's like, oh, all right, sure. Guthrie's committee is tasked with finding $880 billion in savings, a target that can't be met without cutting Medicaid and Medicare, according to Congress's nonpartisan budget scorekeeper. So, yeah, I've said this a million times. Other people on the left have said this a million times. And Republicans will be like, we're not cutting Medicaid. It's not. Look at the bill. Look at the bill. Look at the bill. It's not in there. You can keyword search Medicare, Medicaid. There's no cuts there. Yeah, one of the ways they avoid putting it in plain text in a bill is they say the agency that manages Medicaid has to find $800 billion in cuts. And then if you look at what that agency manages, of course, their biggest expense is Medicaid and everything else is like pennies. So you do the math. And in this case, it is the, House Energy and Commerce Department, or is that right? I think that's the department that manages it. So basically, they manage Medicaid, and that department has been tasked with cutting $880 billion in spending. And most people read that House and Energy, whatever. Okay, yeah, that's nothing. But no, that's the agency that manages Medicaid. So that's substantial, and that's a weaselly way of them getting around saying we're not cutting Medicaid. Yeah. The menu of options includes changes to Medicaid's federal medical assistance percentage, or FMAP, and a new per capita cap on the population of people covered under the expansion. While Guthrie didn't confirm what will make it into the package, he said he'd like to finalize it and vote it out of committee next week. The 90% federal match was a linchpin of the Medicaid expansion under the ACA, also known as Obamacare, enticing states to adopt the provision, which had since extended coverage to an estimated 20 million people in more than 40 states. The ACA took a 3-pronged approach to increasing access to health coverage: Medicaid expansion, tax credits to make premiums more affordable for those who lack employer-provided insurance, and pre-existing condition protections. The Medicaid expansion has been a key part of reducing the uninsured rate to the lowest levels in history, said Larry Levitt, executive vice president for health policy at KFF, a research group. So let's be clear, our healthcare system to begin with is broken. There shouldn't be this expanding Medicaid or covering more people. If we were in an actual functional developed country, everyone would just have free healthcare. That's how it's done everywhere else, every other developed country in the world, whether they have less people than us, more people than us, and they all have one thing in common, much weaker economies than us, but they can do it. And it's not like we don't spend a lot on healthcare. We do. We spend the most on healthcare, but we get the worst outcomes compared to other countries. I wonder why. It's almost like we have a complete for-profit middleman that just takes, I forget what their profit margins were last year, but hundreds of billions of profits off the top. And the main way they get that is by denying claims, which it's crazy. It is crazy. Levitt called the 90% federal promise key to getting both red and blue states to take the Medicaid expansion after the Supreme Court made it optional. Lowering it to the traditional rate the feds pay on Medicaid would be a huge cost shift to states, and many would have difficulty coming up with the extra money. He added some states even have triggers that would eliminate the expansion if the match rate is lowered. So that's wonderful. And yeah, like something or someone has to pick up the bill, and in many cases that's states. Well, the problem is a lot of states just can't afford that. That is the whole point of the federal government, to step in and help with that. Ironically enough, this is going to hurt red states more, like Kentucky, and because they're much poorer and they're going to struggle to pay for this. And we're already shifting a lot of costs to states who are already struggling with their budgets, such as eliminating the Department of Education, such shifting a lot of public funding for schools and such to the states, and it being their responsibility. And then you have just other random healthcare things that the federal government has cut. Most recently, a bunch of COVID programs that they were a bunch of COVID subsidies. They were no longer being used for COVID that much, obviously. So states have kind of transitioned that money into just hiring more nurses and just improving healthcare access and quality all around. And the Trump administration stepped in and took that all away. So that's two major burdens already being put back on the states. And now you're just adding more and more. And a lot of them just aren't going to do it. And millions, dozens of millions of people are just going to lose healthcare coverage. Crazy. So I think that's all for that. Let's look at this. This was another thing that was floated. I mean, it's probably going to make it in there at this point. Here was a quote. I think it was from Mike Johnson. "We want to preserve Medicaid for the most vulnerable, for our kids, our pregnant women, the poor and disabled," he said. That messaging is straight out of Johnson's songbook, mirroring talking points that the Speaker's office has distributed. Johnson himself echoed the same themes during an Axios event Wednesday, arguing that the goal is to preserve the programs for people who are genuinely in need and deserve it. Well, if you're someone who's reasonable and has any shred of human decency, you would say, hey, healthcare is a human right, so everyone deserves it, and needs it. There shouldn't be picking and choosing who gets healthcare. And what we're about to go over is work requirements. The semantics of the GOP's Medicaid promises are crucial. Virtually all Republicans, the president included, want to implement the first ever federal Medicaid work requirements for so-called able-bodied adults without dependents, and to root out waste, fraud, and abuse. Those changes, they argue, create savings but don't constitute cuts that Trump has promised to avoid. So it's crazy. Like, work requirements. I mean, in order to get really healthcare in the first place, it's tied to your employer, a job. Like, that's crazy. Other countries look at us and laugh. Like, there should be no insurance companies. It should be a single payer system, one insurer, that being the government. It works everywhere else. It's been done everywhere else. But here, no, we don't. Insane work requirements. Like, it's already a problem that our normal healthcare is tied to work in like 90% of cases, or pretty much all cases, unless you're paying for it in other ways. But either way, you're paying a lot just to get your claims denied in subpar healthcare compared to other countries that spend much less somehow. And just real quick from Axios. Mike Johnson faces GOP centrist revolt on Medicaid. House Speaker Mike Johnson is staring down a growing rebellion from his centrist wing over cuts to Medicaid and the GOP's big beautiful bill. Why it matters, moderates and swing district House Republicans are trying to balance their loyalty to Trump with their increasingly imperiled re-election prospects. Many centrists are worried that cutting programs like Medicaid too harshly could inflame the already intense backlash they are facing from constituents over DOGE cuts. Driving the news, Representative Don Bacon confirmed to Axios that he communicated to the White House he won't support more than $500 billion in cuts to Medicaid. So this is coming from the centrists that are giving pushback. It's like, we can cut Medicaid, just not $880 billion or whatever, just maybe like no more than $500 billion. Oh my gosh, we're so cooked. Republicans just don't get it. They don't get it. Those are the cuts that don't impact quality of care nor hurt hospitals. A bunch of us will have to be convinced that any other cuts won't hurt patients or hospitals. What do you mean? That is going to hurt them. Like, you don't have 500 billion, 100 billion, 50 billion is more than enough to hurt a lot of people. Like, the conversation here should be expanding Medicaid or Social Security by hundreds of billions, not cutting it while we try to increase defense spending by hundreds of billions. What are we doing? Like, what happened to all the tariff money too? I thought the tariffs were going to make us super rich. Where's all that money? Shouldn't that help us in like not cutting important programs? Like, and this is just Medicaid. There's also the cuts to SNAP, cuts to Meals on Wheels, the VA cuts, the cuts to cancer research, the Social Security cuts by, like, they cut the phone service and they've like cut the amount of offices around the country in half. So I just don't get it. Oh boy. Okay. The other side, some members of the right-wing Freedom Caucus pushed back swiftly on Bacon's proposed ceiling, arguing there needs to be sufficient spending reductions to offset tax cuts. And these are the group of individuals who are like, we aren't cutting enough, we need to cut more. So let's be clear. This isn't like none of these people are good. Some are more evil, some are a little less evil, and some are just evil. That's what this is. These same individuals want to keep all those green energy tax credits and raise the SALT cap deduction, said Representative Eric Burleson. You can't have your cake and eat it too. You're not going to get any tax cuts that the American people want if you're talking about those kind of low numbers on actual reform to Medicaid. Representative, and that was from Rep. Chip Roy from Texas. Between the lines, the dynamic puts Johnson between a rock and a hard place as he tries to cobble together the roughly 218 votes he needs to pass the massive package. President Trump and Republicans are desperate to secure roughly $4 trillion in tax cuts, which they hope will stimulate the economy and boost their sagging poll numbers. It's not. These are just an extension of the tax cuts from 2017, which didn't do anything to stimulate the economy. It didn't do anything to improve wages. This is all stuff that has been studied and you can go back and look at. The benefits to the poor and working class, the middle class, were negligible compared to what the wealthy got. So this, you need to understand this. These tax cuts that we are destroying our social safety net for, they're not going to do anything to help you. They're probably going to hurt you in the long run. The measure would also raise the debt ceiling, a key priority for Trump in order to deny Democrats potential political leverage. Yeah, I mean, they have to increase the debt ceiling even though all they care about is debt and paying down the debt and cutting the deficit. But we need to increase the debt ceiling. Okay. So everything you said was a lie. It was just cover so you could cut non-defense programs while pumping hundreds of billions more into defense programs. That's my biggest problem here. It'd be one thing to see their experiment play out in, if they actually did try to cut everything. And I mean everything. The programs they're trying to cut now. And also military spending, defense spending. I'd be interested to see if they could actually get a surplus and actually start paying down the debt. It'd be interesting to see a principal take or principal attempt at this. Interesting to see. I don't want to see it. It'd just be interesting in a hypothetical. I guess the hypothetical, you could just look at Argentina. But let's be clear. Either way, it would be disastrous. But like, if you're going to say this shit, just be principled and do what you're going to say. But they don't. They don't care. They don't care about the debt. They don't care about the deficit. They don't care about you. They just care about giving tax breaks to their rich friends. It takes away the open checkbook in 3 set of the one idea per capita cap, which would place a limit on federal funding per enrollee and Medicaid expansion. Insane. But the proposals would likely kick many lower income enrollees off the Medicaid rolls, leading some moderates to oppose them. Rep. Mike Lawler asked about another proposal to lower the federal share of costs for the Medicaid expansion. Replied, I've been very clear about this. You guys keep asking the same stupid fucking question. No. Nick Lalota said of the per capita cap, my sense is that would be a cut, and I'm not in favor of that. If the reconciliation bill passes the House, it could face an even tougher path in the Senate. Members like Senator Josh Hawley have staked out a position that they oppose anything that would cut Medicaid benefits. Well, be prepared, Josh Hawley, to pretty much oppose anything that comes out of the House then. Let me know what you think in the comment section down below, and I will see you in the next. If you made it to this point in the video, I just want to give a special thank you. If you enjoyed it, please hit that like button down below, and if you really enjoyed it, maybe consider hitting that subscribe button while you're down there. I want to hear your thoughts in the comment section. I will try to reply to any and all comments that I can. Until next time, watch that video on screen.